Hello, and welcome to the Mimosa Matters podcast series. In this series, we will bring you interesting perspectives on the clinical, research, and technological perspectives for near-infrared spectroscopy imaging, or NIRS, and introduce you to Mimosa Diagnostics. I'm your host, Douglas Queen. Today, we are bringing you a Mimosa Matters poster chat, where you can learn from our collaborators about their important research. Thank you for tuning in and joining us on today's poster chat, where we will be hearing from Dr. Matthew Regulski. Dr. Regulski is the Medical Director of the Wound Care Institute of Ocean County in New Jersey in the United States. Tell our listeners a brief summary of your clinical practice and experience.
I've been in practice now. This is my 22nd year here at Ocean County Foot and Ankle Surgical Associates. I'm also the director of the Wound Institute of Ocean County. Both are here in Toms River, New Jersey. So I'm predominantly doing wound healing, diabetic limb salvage surgery, reconstructive surgery, mostly concentrating on that because that's what brings me the greatest joy.
Welcome, Matthew.
Thank you, Doug, for having me. It's my pleasure to be here.
Let me start our conversation by asking you a few questions about your recent poster entitled The Effects of Human Cryopreserved Adipose Tissue Allograft Implantation on Tissue Oxygenation in Diabetic Neuropathic Patients with Plantar Ulcers, such that our listeners can get some insight into your experience with NIRS imaging.
Yeah, this was really fascinating because we actually took cryopreserved human fat and we were injecting it into these areas, not only to help to heal, but I think the greatest utility of it is prevention. 50% of diabetics will have a recurrence of their ulcer within a year, and 65% will have recurrence within 3 years, because when they heal, it's just scar tissue. The fat pad gets destroyed from inflammation, from abnormal pressure, the biomechanics, and thus the recurrence is very easy because they lose that elasticity, they lose that cushioning, so to speak, a lot of tangential and shearing forces on that wound. So we're doing a lot of fat injection, essentially blowing up the flat tire. If we can put human fat into that with a little bit of cellular component in the scaffolding proteins, because fat is highly angiogenic. It needs a lot of blood flow to maintain its metabolism. So it has a tremendous amount of angiogenic stimulating growth factors that are in there, and as well as not only making blood vessel, but also recruiting adipocytes to that area. So we're injecting it just under the skin, into the subcutaneous space where the adipocytes live. And so we're improving blood flow, we're improving fat, we're offloading it almost internally, and hopefully preventing the recurrence of the ulceration.
Great, and give us some background into the study that's featured in this recent poster at the camps and SAWC conferences.
Well, we were taking people with that had small wounds or that had a pre-ulcerative lesion, a callus with blood in it, perhaps. Callus raises the risk for ulceration in a diabetic neuropathic patient 11 times greater. So when we would see that the beginnings of a wound, even despite good offloading with diabetic molded shoes, because of the abnormal mechanics that these people have that predispose them to the ulcer in the first place, then we would start injecting under ultrasound and getting it into the subcutaneous space, and then following them, continuing to do all of the good things that we've been taught to do and prepare to repair, proper offloading, and then treating the wound as well, and watching the progression and utilizing Mimosa so that we could see if there was increased oxygen, temperature, how was the blood flow doing in response to the injectable fat that we were using.
And what was the outcome of the study featured in the poster?
Well, the outcome was really good. We could see, and Mimosa was the key to this, so that we could actually see real time what was going on with improving blood flow and improving oxygen, and thus also temperature would go up slightly as well. But again, fat makes blood flow. It needs blood vessels to support its high metabolic activity, which are they're highly vasculogenic, so they make new blood vessels. There's a lot of VEGF and basic fibroblastic growth factor, TGF beta, PDGF that is in there to make blood vessels to support that, but as well as a lot of scaffolding proteins to enhance adipocyte migration into that scaffolding protein and start making more fat. So it was nice with the Mimosa that we could actually see what was going on, and especially we would inject and then we would wait 15 minutes and then take a picture too to see some increases in the oxygenation afterwards, which was fascinating. But with Mimosa, you get this real-time diagnostic so that you have some kind of proof, some kind of evidence of what you're trying to accomplish. It was great.
And what would the key messages be to your fellow clinicians from this study?
That is particularly well, the injectable fat does a lot of good things in the prevention role, and as well as I think it does help to heal. But there is nothing that we can do in the preventive role other than offloading. Good diabetic shoe, but people still get 50% recurrence in a year, 65% recurrence in 3 years because the genesis of the chronic wound is quite multifactorial. But at least by blowing up that flat tire, we give more cushion to the area, we dissipate the pressure more and prevent the recurrence of the ulceration because there's nothing on the market that you can use to prevent the recurrence of that ulceration internally. And the mimosa gives us that real-time assessment of actually what is going on inside there with that fat, and able to track the progress of the growth of that fat, and ultimately in the prevention of the recurrence of the diabetic foot ulcer. But we've used it in the heels, we've used it on the side of the heels, we've done some in the ankle, on the top of the foot. You can use it really where you get these high pressured areas in that prevention, but particularly in the diabetic foot ulcer. It's been outstanding.
Great. Thank you, Matthew. Thank you for giving our listeners an in-depth insight into NIRS imaging, Mimosa Pro, and its utility in clinical practice. Thanks again, Matthew.
Thank you. It was my pleasure.
Well, that's our poster chat for today. We hope you gained some new perspectives on NIRS imaging and its utility in wound management. Be sure to visit Mimosa Diagnostics at www.mimosadiagnostics.com and check out our Mimosa Learning Plus section for a copy of the poster and the video podcast. Also visit our social media channels, add your comments and learnings. We want to hear from you.